Hi everyone, I will introduce our presentation. Our sustainable goals is good health and well-being. I'm Yan Ruchen. Our members are Hong Minjiang, Kunting Liu, Panfeng Zhang. Our presentation is divided into 4 parts. Firstly, I will talk about part 1. The many diseases we are suffering from nowadays, such as mental and physical health, also the HIV, the immunication, and also the importance of children's health. The biggest health problem facing the world today is COVID-19. Therefore, our design direction is mainly to educate children about healthy lifestyle. Also, mobile application to help monitor health, exercise and sleep with reminders, and to include COVID-19 data, as well as smart product for paramedics. Okay, now let's move on to my map. As the major challenge is to improve healthcare and medical system in remote area, we aim to design products that are sustainable, adaptable for all age group. This is of great relevance to people with unhealthy lifestyles. Link of exercise and healthy problem. So COVID-19 affects our healthy lives. The COVID-19 date updates and knowledge of epidemic prevention in the products, and as well as the tiny identification of high-risk areas will help us to live a healthy life. Therefore, our 3 product directions are education on children's health and the mobile application and the smart products. Thank you everyone. Let's move on to next part.
Hello everyone, my name is Curtin. The design case about health that I want to share is the design of an app. This app called Headspace. It aims to relieve stress by focusing on people's thinking activities to give the brain an immersive experience. And first of all, its most attractive place to me is the design of the vector icon in the picture. The combination of warm colors can make people with tight nerves feel cordial and comfortable under the pressure of fast-paced life. In addition, the core of this app is that all themes are presented in the forms of audio. The viewer can create their own immersive space through the stories told by hundreds of meditation instructors and achieve the effect of relaxing and relieving stress. And in terms of shortcomings for the content, I think this app lacks the introduction of professional knowledge such as meditation. Many people do not understand meditation and do not believe that meditation can be used to relieve stress. On the other hand, the interface does not classify different types of pressure, so it cannot provide target treatment. And in terms of design, the sleep model uses blue and purple color combinations, which may bring a sense of distance to the viewer. And the entire model is in the form of illustrations. Although it can bring strong visual effects, but it is out of the style of the entire app. And in general, I believe that in terms of content and form, the app should analyze the root causes of stress and conduct relevant professional knowledge popularization to viewers. In terms of design, this app should attract viewers with strong visual effects while enhancing the interaction with viewers to get better feedback.
According to an article published in The Lancet in 2019, 4.2 million patients worldwide die within 13 days after surgery each year, more than the total number of deaths for AIDS and malaria. The reason is not only the complexity of the disease, but also the level of medical treatment. Half of those who die after surgery occurred in low and middle income countries. According to Dr. Dimitri of University of Birmingham, surgery has always been a forgotten corner in the field of global health, and annual research funding is much lower than that of other diseases. Not all postoperative deaths can be avoided, but many deaths may be prevented by increasing surgical research, skill training, and updating surgical equipment. In order to prevent millions of people from dying after surgery, new designs are needed in improve the quality of surgical treatment and the skills training of healthcare personnel. According to this special situation, OSSO company designed a scheme based on air technology. OSSO AR use virtual technology to simulate the surgical environment and replace the real surgery by situation. In the virtual operating room, doctor can safely perform more complex operations. Virtual surgery combine human tissue dynamic and in the virtual environment, the patient will bleed, cough, and have all kinds of reaction. But in the virtual environment, doctor can avoid bringing real risk of patients and improve their surgical skills through realistic effect. But this design also has some disadvantage. For example, this design needs some basic equipment, support, and use training because the VR system needs additional equipment to support this work. The purchase and the training of equipment is also an important issue. The second point is that the virtual environment needs further development in terms of touch and perception because this is a obvious difference between the virtual touch and the real touch. Although there are still some problems with this program, it still plays an important and positive role in helping to promote the health development of the world.
Then I'd like to introduce the third president. It is called CPR first aider. Once cardiac arrest occurs, if patients are not resuscitated in time, it will cause irreversible damage to vital organs and tissues due to hypoxia. CPR first aider is an automated device that provides respiration assistance and chest compressions. It is designed to reduce time for resuscitation and relieve the physical workload on medical personnel while avoiding the loss of resuscitation effect and accidental injury caused by improper technique and fatigue during CPR. The device includes a breathing mask that automatically delivers oxygen while assisting the patient to breathe. The CPR module has 4 legs and chest strips to ensure stable, sustained, and effective pressure to the patient. Its LED screen displays the patient's blood oxygen concentration and electrocardiogram in real time. CPR first aider is a compact and can be installed in high traffic areas to potentially save thousands of lives. It is easy operated and includes a first aid kit and a button to quickly call for an ambulance. Thank you for listening to our presentation.